I'm really grateful that this study was conducted. And I think we have a long way to go in terms of figuring out pathways to mending the trauma, especially given that we are living in a society where there are a sizable number of people within the US who don't even acknowledge that racism is a
Exists.
real issue. Yeah.
Welcome to Attached, a podcast about the loved ones we're attached to and the good, the bad, and the ugly advice about those relationships that maybe we shouldn't be so attached to. We here at Attached want to share ways to enhance your relationships and debunk all of that bad relationship advice using science. I'm Dr. Patricia Robertson out of the University of Tennessee.
I'm Dr. Sarah Woods at UT Southwestern Medical Center.
And I'm Dr. Sasson Nagash from San Diego State University.
This week, Sasson is bringing us an article about the impact of racism and trauma on the well-being of Black mothers and their children. Written and led by Dr. Yara Mekawi and all, it was published in the Journal of American Academy of Child and Adolescent Psychiatry, titled Intergenerational Transmission of Depression, examining the roles of racism and trauma among Black mothers and youth. But before we start talking about that article, a few housekeeping items as always. If you have some new research on relationships that you want us to talk about, send it to us. You can email us at attachedpodcast@gmail.com, tweet us, Facebook us, Instagram us, all at Attached Podcast, or go straight to attachedpodcast.com and send us a message. If you would like to support this little podcast and help us get relationship science out into the world, please consider going to our Patreon page, patreon.com/attached, and donate. As always, wherever you listen to Attached, YouTube, Apple, Spotify, and so forth, so on and so on, please rate, review, and subscribe to it. All right, are you guys all ready? Let's get into this week's episode. We in this country have failed to effectively acknowledge, understand, and address the mental health implications of racialized discrimination among the Black community. We have even less awareness of the intergenerational impact of racism and associated trauma on maternal and child mental health outcomes. This article attempts to get us thinking about that. Sasson, I'm so glad that you have brought this article titled Intergenerational Transmission of Depression, examining the roles of racism and trauma among Black mothers and youth by Dr. Mekawi. Talk to us about what they found.
Thanks, Pierre. So this was a cross-sectional study conducted using a sample of about 148 mothers and children. And they identified as Black or African American and ranged in age. The mothers did from 20 to 59. And I think the average age was somewhere around 30-something years old. And the children were between 7 and 13. So young children, adolescents, older adolescents were not included in this study. And the participants resided in a large urban community in the southeastern part of the US. I believe it was Georgia. And most received, in this study, the mothers received at least a high school diploma. Employment status was not determined, and neither was romantic status. So we don't know if these mothers were in partnerships or not. And the participants with intellectual disabilities or who were identified as having children on the autism spectrum were excluded from this study. So a little bit about the demographics, just to give us a sense of who exactly participated. So as you mentioned, there's little empirical data that exists that examines really the role that racism has on the intergenerational transmission of depression among mothers and their children. I argue that that extends also to Black men, but that wasn't what was studied in this article. But to address that void, the authors attempted to do a few things. One of the things they wanted to do was replicate past findings that examine maternal experiences of racism and the impact that had on their depression as well as their children. But that was done using individuals from middle income status. And so in this study, they wanted to replicate those findings and looked at maternal experiences of racism to see if they were significantly related to depression among, again, mothers and their children within communities with few socioeconomic resources. Another thing they wanted to look at in this study was if maternal trauma was indirectly related to children's depression via the effect of the maternal mother's depression symptoms. And last, they wanted to look at trauma separate from racism. And this, the third leg of the study was really looking at the indirect effects of maternal experiences of racism on children's depression, again, via the mother's depression and how it was related to the impact of any exposures the mother has had in the past to trauma. So that was, I think, a interesting piece to add, and I'll speak to that later in my discussion. So in terms of what they use to measure some of these factors, in terms of trauma, they use the traumatic events inventory. And that I believe has about 19 items on there, and it's used to assess for trauma symptoms. Interestingly, when looking at some of the descriptive statistics, we noticed that like 92% of the individuals who completed this study experienced some form of trauma.
Wow.
IPV, sexual assault, serious injury accidents, and some other items that were described. And more than half reported experiencing at least 4 types of trauma. We'll talk about that because this was a convenient sample, and it really drew in participants from public health agencies dealing with trauma. Okay. It makes sense that these large numbers were large, but 92% is significant for sure. And about 67% reported experiences of discrimination, racialized discrimination. And half the participants reported minimal symptoms of depression. 15% reported mild, 17% reported moderate, and then 17% again reported severe symptoms of depression. And among children, that number was around 8% who identified as having clinically significant experiences of depression. I should note that it was the mothers who completed reports on children's symptoms of depression. They, I believe, tried to gather that information from the children, but there was concern about the validity of the measure for that. So they used mother's self-report. So we'll talk about that in terms of the limitations. But so what did they find? To me, not surprisingly, given my experience in the research looking at racialized trauma and the impact that has on the body and mental health. But they found that mothers with experiences of racism were more likely to have more severe symptoms of depression, as well as their children, who also experienced having more symptoms of depression. Mothers' experiences of racism was also tied to their children's symptoms of depression via the mother's depression symptoms. So that sort of talked about the fact that it wasn't necessarily the racial experience that caused the children's depression, but the mother's experience of depression that was really linked to that depression among children. Not surprisingly, the extent of the mother's exposure to trauma impacted the indirect effect of racial discrimination on children's depression. I was, again, not surprised to find these, but I was really also glad that we're having more conversations around the impact that something that we tend to talk about as like a social problem is really a medical problem, a mental health problem in our society. And so to see that data reaffirm that to me was, I think, exciting, because I'm really hoping that we can use hard science to push this work forward, particularly around addressing racism in this country and the impact that it has on our Black community. So with regards to the third finding, they found that the extent of the mother's exposure to traumatic experiences impacted the indirect effect of that their experience of racism had on children's depression, and such that the indirect relationship between maternal experiences of racism and children's depression was not significant among mothers with relatively low exposure, trauma exposure.
Wow. So, like, in other words, mothers who don't have trauma exposure have very low trauma exposure. That intergenerational transmission of depression seems to almost disappear. Is that a fair conclusion?
Yeah, I mean, even despite having experiences of racial discrimination, right, that seems to be an important factor to consider when looking at that. It's not just as necessarily the racialized discrimination that they experience, but that in combination with their exposure to trauma.
Wow.
Yeah. And so as far as some of the limitations, I mean, this was a cross-sectional study, so we can't make any causal inferences based on just the way the data was collected and also analyzed, and then also looking at the children's experience of depression through reports from the mother, as opposed to hearing it directly from them or through their own perspective, was something that we couldn't assess in the study. And also the fact that they did not assess for children's experiences of racism too, which I think is an important piece of this conversation, and how that may impact their experience of their mother's exposure, right? Especially thinking about the intergenerational impact of racism being sort of transmitted through the generations. And because this study was focused on youth between 7 and 13, again, we don't know that we can generalize this to really young children or adolescents and beyond the age of 13, around that period where we know that mental health symptoms tend to increase quite a bit. In terms of looking at racism, I think racism experienced in a more cumulative way, and oftentimes the way we assess it is very simple. And I think, I appreciate a lot of aspects of this study, but I don't think that it was assessed in its complexity and in terms of the cumulative way which it often is experienced by this community, the Black community. So rather than looking at experiences of racism, thinking about the historical implications and the historical factors and the social, as well as personal experience of discrimination, I think is really important to understanding the overall real impact it has on people's mental health and their body.
I was just going to say, I wonder if part of what you're also maybe alluding to is the fact that they asked about sort of lifetime experiences of discrimination as yes, no questions, and whether you're also sort of suggesting that that maybe doesn't necessarily capture the weight or the volume
Severity
of these experiences in terms of how often within each category these experiences may be repeated and repeated and repeated over time. And I'm not sure exactly if that's it sounds like you're also saying like needing to really think about racism as a multi-level experience that's really complex, but I wonder if that's also part of what you're talking about in terms of the intensity of any of these experiences.
Absolutely, yes. I think the way we capture trauma is not refined in terms of the data, the literature, and definitely in terms of the measures that we have. I'm speaking from personal experience trying to find these measures within some of the communities that I've worked with. And so I think there are some research limitations, but I think, in our ability to really conceptualize what it really means for the Black community in terms of the historical trauma that they've experienced, the constant exposure, social trauma, that racism that they experience. I don't think the study captured that. And I think so many don't tend to do that. But especially looking at racialized trauma, like that piece where they sort of separated racism and trauma. But I'm like, racialized trauma is in and of itself a really serious thing for within the Black community, and the implications of that are pretty significant when we think about mental health. So yeah, I'm curious to hear your thoughts on the article and yeah.
Well, and related to what you're just talking about in terms of how they assess these patients' trauma experiences, sort of similarly, what you're talking about, right, is that there were, I think, 19 different examples of traumatic experiences that these women could have reported ever having experienced. But it really struck me in sort of reading what some of those included. These were not that there's any such thing as a small trauma, but this list was a list of intensive traumas about right, witnessing the use of a weapon against a loved one, being on the receiving end. I think you said earlier, Sasson, being receiving end is not the right language, but being part of a relationship where there's intimate partner violence, having sexual abuse experienced in childhood. And as you said earlier, I think there's only 8% of this sample. I mean, 8% of these women said, none of these traumas have I experienced. That is almost every single person.
Mm-hmm.
I mean, it's unreal. And the average number was something like 3.5, right? And even at that level of trauma, we didn't see that amplify the connection between racism and children's depression. Which is meaning, right, that people are experiencing more trauma than that. And that looks like how, in this study, that's in concert with also these other experiences, these other traumatic experiences of discrimination. And that is to think about how much toxic, persistent stress that would include is heartbreaking. That's really, really heavy.
I agree. I think I was reading through this article and thinking about just how just parenting in general is in and of itself so stressful.
Right.
But when you add these experiences of racism constant, I imagine happening, because we didn't assess to see how often this stuff was happening to them either, right?
Right.
Whether they experienced it at all is one, but like you said, Sarah, the consistency of that exposure, we don't even know. And I imagine like there are significant implications on the children from it. I guess I'm just really not surprised to see that it has an impact. It really,
of course,
to me, is it's so profound just to think what mothers have to endure in order to survive, let alone to help another human being thrive in their life.
And that, I think you had said earlier, Sasson, these were women recruited from medical settings, right? Primary care, emergency room, gynecology. Like these were just waiting room samples. This is women coming in for any other kind of appointment, being recruited for this. And if we're not doing this kind of screening, we would have missed all of this. These women are going to the regular doctor's appointments for any number of reasons. And we so infrequently ask people about these experiences. You're missing all of this. This is what so we have potentially, I think, an opportunity to intervene and support these families. And not that those interventions necessarily need to come through healthcare settings, but I think I was really, really struck by the fact that less than 1 in 10 women said none of these traumas apply to me. And the fact that they were all sitting in a waiting room about to see a healthcare provider. There's got to be a place there where we could do a better job of capturing and intervening.
I think to kind of build on what you guys are saying, as I was reading through this, I put on my statistician hat for a little bit and noticed that these coefficients, these effects, were quite large, and they didn't include the effect size, but you guys are going to be surprised about this, but I did calculate the effect sizes myself. And sometimes when people say things are statistically significant, meaning P is less than 0.05, it's a small number, right? That the association between the two numbers are a small number and they're statistically significant, maybe not terribly meaningful. That was not the case here. We're talking about small to medium effect sizes across the board with experiences of discrimination on the mother's depressive symptoms was a Cohen's d of 0.39, which is very meaningful. And from maternal to child depressive symptoms, it was even bigger, a 0.42. And that indirect effect, that mediation effect, the coefficient that was testing the intergenerational trauma was a 0.17 coefficient, which is smaller, but anyone who reads a lot of these know that indirect effects are always really tiny, and this is a large indirect effect, all things considered. So from a purely numbers perspective, these are not just throwaway associations. These are meaningful, large associations that we need to, as clinicians, need to start paying more attention to. I'm curious from you guys' perspective, what interventions do you know exist that simultaneously target the effects of racialized discrimination and the trauma that people face? Is there anything out there?
I mean, the experiences of racism and trauma, I mean, we know it changes our nervous system, right? And our brain chemistry. Like there's no question at this point, just how much we've come, at least with regards to trauma. But with racism, I think we're starting to come to understand that. And I think given the considerable impact it has on the body, I think somatic work is part of the way forward here when we're talking about treatment.
Talk to me about what somatic work is.
So as far as, it could look very different based on whatever theoretical model you're using, but there are various models now. Fortunately, I think a lot of people are coming around to somatic work. It used to feel much more like like this, I don't know how to describe it without
new agey, hippy dippy.
Yeah. And I think a lot of people are starting to integrate it into their work who do more what we consider like traditional talk therapy. But I think understanding the mind-body connection, particularly when there is trauma and when we think about intergenerational trauma and how we don't even acknowledge its existence in our body because we are not aware of it, is really important. I think often, like when we're doing talk therapy, people have to count on their memory of things, right? Things that they know have happened. But when we're talking about trauma and racism and the historical context of that, there may not be an awareness there of the impact that it's having. And so I think the somatic work is one way to really identify in our body sometimes where that might be hidden. So I'm really interested in the somatic aspect of it and having people really look at that more closely. And also thinking about just, when we're working with this particular issue, it is really important that the therapists be really culturally attuned to what's, going on for the communities that it's serving, particularly these highly oppressed communities, and understanding, taking oppression sensitive approach to the work, I think is another important piece. You can't just say I'm culturally aware. I think you have to really understand what oppression does to the body and what it does to the mind, especially when it's happened over multiple generations. So I think there is an awareness that therapists must have around the specific history of the communities that they're working with. So really informing themselves beyond what's happening now within these communities, but what's happened in past generations that might inform what might be sitting in their body at a molecular level, where their DNA is now altered because of all of these past traumas.
I think the authors also reference the Embrace Project, which is a very cool, it's an incredible research project, but really an intervention to support families, especially with young people, through racial stress and trauma that involves racial socialization. So I think it's the Embrace acronym, forgive me, is something along the lines of like engaging, managing, and bonding through race, and engages families, parents, and kids in this racial socialization process. So sort of working on reducing some of this racial stress and trauma related to race-based discrimination while promoting positive conversations and connection around racial identity. And they write some of the most beautiful papers I ever read. They're doing phenomenal work, really family-based work, looking to intervene in those relationships and talking about some of like race-based pride, right? And some of the shared positive experiences about having a shared cultural identity. And I really loved seeing that reference. The conclusion of this paper, if you're listening and you're a researcher with access to papers, this is one that's well worth the time to pull up. I think the conclusion, the discussion, how they have couched what they have found here and next steps is really beautifully done. The authors did, I think, a really beautiful job. And in there, they reference that work too, which is very cool.
What should our listeners now take away from this study and our conversation therein?
I feel like this is, the study, I think, is a reminder to us that there's still a lot that we really need to think about and be mindful of when we're serving, as clinicians in particular, working within the Black community. But in general, I just think one of the things I want us to really continue to really think about is just the experience of racism and trauma on our bodies, right? Just like at the molecular level, like our nervous system, our brain chemistry is all significantly impacted. And this can happen through the generation. So you can be born into having some of these alterations in your DNA. So I think as the work around this, the research continues to grow, I think as clinicians, we have to really think about how do we improve our work, expand our work, adapt our work to really work around these issues, and really thinking about, again, I mentioned earlier somatic work, but thinking about how that could be utilized. Somatic work, including, everything from breathing exercises to meditation to really just helping people understand some of the ways, like body sensation, and understanding where, when they're activated, it isn't showing up in their bodies. And I think thinking about taking, if we're not already in our practice, thinking about engaging in trauma-informed work, going a step further and thinking about trauma-specific work and adopting that and when working within the Black community and working even with youth, especially, I think, for those who think, well, the youth have been exposed to less maybe trauma or maybe less racism, so maybe there's no room for conversation around issues of race. But I don't think that this is what the study is saying. I think it's saying these conversations may benefit to have, children might benefit from having someone who's really understanding of what impacts racism might have in their lives, whether it's experienced directly or indirectly. So taking a social justice approach is important, both in the education of medical and mental health professionals. I also think we want to be mindful of some of the larger systemic barriers that may get in the way of some of this work. The lack of Medicaid expansion, the lack of diversity in terms of those who represent the medical and mental health fields, and how it's just going to be that much more important for us to, if we don't come from those communities, if we're not, members of the Black community, identify thinking about how we do this work in a really thoughtful way. And how do we, the age-old conversation for me is like, how do we get more diversity within our fields so that people could feel more comfortable to approach us and express their needs? I think even if you have mothers and children experiencing, severe depression, histories of trauma and racism, if they don't trust the system, if they don't trust the medical professionals or the mental health professionals that are out there, then, what is it all for, right? We can't really do this work unless people are trusting us to do the work with them. And that's going to take a lot of consideration for how we do that and really bridge that gap. So I think, I'm really grateful that this study was conducted. And I think we have a long way to go in terms of figuring out pathways to mending the trauma, especially given that we are living in a society where there are a sizable number of people within the US who don't even acknowledge that racism
Exists.
is a real issue. Yeah. And that people are exaggerating their symptoms or that there's no real consequences of racism.
Right.
That it's a social issue and not something that has real life health implications for people. So, there's a long ways to go in terms of getting people on board, but hopefully we can continue to spread the word and get people to see that their words, their actions matter and that they can cause real harm to people's lives. And
as evidenced here. Thank you so much for bringing this article. And as always, thanks for listening to Attached. If you're interested, a link to this study is in our show notes. Please help us share this work and share it with others. As always, your reviews and ratings of this podcast help with that, help us find more people. So please consider rating and reviewing this episode. Finally, if you have any relationship questions you want us to talk about, email us at attachedpodcast@gmail.com or get at us on any of the social medias at Attached Podcast. We cannot wait to talk about it.